Welcome back to BNC. I'm Laverne McGee. Thanks for being with us. You know, with all of the other acknowledgments this month, you'll have to remember that September is also Sickle Cell Awareness Month. And about 1 in 3 African Americans carry the sickle cell trait, and they don't even know it. So it's important to become more aware of this disease and also help focus attention on the need for research and treatment of sickle cell disease. Joining us now to discuss this is Assistant Professor in the School of Public Health at the University of Michigan, Dr. Melissa Creary. Thank you so much for joining us. Let's talk about these recent studies and clinical trials that show promise in sickle cell research with a new gene therapy. Are we looking at an actual cure for sickle cell disease?
Hi, Laverne. Thanks so much for having me. The FDA recently approved a clinical trial for sickle cell disease called CRISPR. And right now, there are about 8 clinical trials in process, but this is one that's showing a lot of promising results. And with this, it's a gene editing technology that basically snips a part of your genetic code, and then you're able to exist essentially sickle cell free. We have seen that there have been positive results in at least one patient, and we've been following this patient along, and so far they're doing great.
That is really exciting to hear that. And this technology sounds amazing that you're discussing here. We know that life expectancy for people with sickle cell has increased, but what are some of the other advancements in sickle cell research that has helped people along the way? Because what you're talking about sounds like it's a ways off in terms of actually coming to the masses.
Absolutely. So we're still in trial period with a lot of these clinical trials. Though things look promising, there are also some promising things that people can do if you're currently living with sickle cell disease. And as you mentioned, that life expectancy has increased with this population. A lot of that's due to some really transformative research that happened in the 80s that we have basically benefited from. And that involves something as simple as penicillin and making sure that babies are screened universally across the United States with newborn screening. As soon as we're able to find out that babies are born with sickle cell disease, we're able to address the issue easily and more information in the pediatric side. That doesn't take away from how complicated this disease is, especially as you grow into adulthood. But what we're seeing is that many more adults are thriving and living much longer.
Which is always good to hear. And you know, sickle cell's been often labeled as a black people's problem. Has that label affected how research and treatments are funded? And is it true? Is it a black people's problem?
That's a great question. So I think what we should know about sickle cell disease is that in the United States, it disproportionately affects African Americans. This is certainly true. And that when we look at the diaspora from the African continent, that's where we see the majority of sickle cell cases. What's important to know is that sickle cell does not exist just within the Black body. So we know that sickle cell exists according to where malaria was endemic, and that means in the Mediterranean, in parts of South Asia. And so it's important for us to know that while this is disproportionately constructed as a Black disease, particularly in the US, but also in many other places, it does affect many other populations. In fact, there are a lot of campaigns that try to show that there are many different faces of sickle cell disease. There's a problem when we think about how invisibility gets translated when we think about only Black people having the disease. That being said, because of this construction and because so many people think that this is a Black people's disease, we absolutely do see health inequities show up when it comes to research and advancement around this population. When we compare sickle cell disease treatment, advancement and cure and care compared to other kind of diseases like cystic fibrosis, we can see that there is absolute a disparity between how research is funded, how the infrastructure of research is created and sustained. And it's certainly a problem in terms of the long-term sustainability of how advancement gets to be where it is for the sickle cell disease population.
So if we know that it is prevalent in Black communities, is there a way to know whether or not you're passing it along to your child? Maybe you don't exhibit symptoms, but you're passing it along, and is there anything you can do about that?
Yes, so we find that a lot of people may or may not know that they're carrying the sickle cell trait. And that may be because when a mother is giving birth and they have sickle cell trait, that they may not receive that information from their doctor. Or they may receive that information from their doctor about, your child has sickle cell trait, but they were told that it was benign and not the disease and not to worry about it. And there are implications around that information. It's important to know whether or not you have trait status, because then it's important to know whether or not you can potentially pass on that gene when it comes to the propagation and reproduction of future children. So while it's important for us to understand as a community that you may have the trait, many of us don't know. And so it is a simple test. A lot of the local Sickle Cell Disease Association chapters will offer that test. When mothers become pregnant, you can also request that test if it's not automatically provided for you.
So as we close Sickle Cell Awareness Month, what can people do to keep funding toward research and clinical trials going?
Well, I think there are a number of things that can be done individually as we are turning to the close of September as Sickle Cell Awareness Month. I think things like supporting transfusions and donating blood, advocating for better treatment, education, and research, educating others about sickle cell disease and the sickle cell trait. And obviously, like we were just discussing, get tested for sickle cell trait if you are of African descent and don't know your status. I think that when it comes to the research infrastructure, it's important for physicians and other community members to galvanize together to help think about ways that we can begin to push sickle cell forward. I would say that right now we are in such a prime moment where the CRISPR technology is so promising for the sickle cell foundation. I'm sorry, for the sickle cell population. And we also have so many new media accounts for how people are living their lives. The lived experiences are really being told right now throughout different aspects of the media. And I think that those things will help raise awareness and help keep people accountable for creating the infrastructure and potential funding towards sickle cell disease advancement.
Well, I'm so glad to hear that things are headed in a positive direction. Thank you so much. You've been so informative. Assistant Professor in the School of Public Health at the University of Michigan, Dr. Melissa Creary, thank you so much for being with us here on BNC. And coming up next, the trading asset that's created a few billionaires, a couple here and there, but certainly some people making a lot of money. But it's also created a lot of anxiety from